My name is Dr. Brandon Thornberry. I'm one of the veterinarians partnering with your veterinary hospital, and wanted to share from a veterinarian's point of view our approach to the itchy dog. It's a really common reason why we see pets entering the veterinary hospital, and by inviting you into this mindset of the veterinarian, we can allow you to ask really good questions to your veterinary team and get the best care possible for your dog. Most things start off with a really thorough history, and the itchy dog's no exception, right? The acronym that I usually use for my history taking is DEMO. D stands for diet, so what diet is your pet currently on? E stands for environment, so any environmental changes or new exposures, new detergents, any other pets in the house having similar symptoms. M stands for medication, so any meds your pet's currently on or maybe been given for itchiness that has worked or not worked. O stands for other symptoms. Not uncommon for us to see an itchy dog having an itchy paw and an itchy ear, or an itchy paw and having some GI upset. All these things can paint a picture for where we take things next. Wanted to give a highlight as far as our physical exam aspects and pearls to approaching the itchy dog. There's a number of things we're looking for from head to toe. This is just a high-level overview. We're gonna look at the eyes and the ears, right? There can be evidence of hair loss around the eyes or redness of that eye, that pink fleshy part, conjunctivitis. Looking down into the ear, we can see evidence of infection or redness or pain there too. There are common zones for allergies to manifest. It can be the ears, it can be the armpits called the axilla, it can be the groin region, the tail region, the paws. Those are common areas that if your pet is irritated in those regions, maybe could be suggestive of environmental or food allergies or both. We're also going to take, as far as having a good physical, we're going to look for other regions that are affected. If there's a lot of hair loss or itchiness around kind of the tail base here, what we call the caudodorsal region, this can be an area where flea allergies tend to accumulate because it's out of reach of the dog, whipping around and try to get rid of those fleas. The fleas know they can hide out right here in a good place. Looking at the paws is also really important. Looking for redness between the webbing of the paws. If a pet is fixating on one paw, sometimes that can be more out of anxiety or behavioral changes. If they're fixating on multiple paws, that can build a case more for potentially an allergic reason or like a irritation reason for why they're bothering that spot. So some common highlights as far as the itchy dog that I want you to take away are, one, that a lot of common initial tests start off with a skin scrape and a skin swab, looking for evidence of parasites like mites or looking for evidence of infection. Itchy dogs really need to be on year-round prevention, as well as their housemates need to be on year-round prevention, because a common trigger for itchy skin in these dogs can be due to insect bites. Insect bites in some dogs might only trigger a single area of irritation, whereas some other dogs might have an entire body-wide flare-up due to a single insect bite. So having them on that prevention is hugely important in maintaining good, consistent, healthy skin throughout the year. There's two battlefronts when it comes to if your pet has a skin infection. There's treating with the antibiotic and the antifungal, treating the infection itself. And then the second battlefront is, why did the skin barrier break down in the first place? Are we treating underlying allergies, either environmental or food? Are we treating low thyroid production, things that set up the skin for that infection in the first place? So remember, there's two battlefronts, and we might treat the infection, and that might be done in a couple weeks, but we still need to do something about that underlying reason the skin barrier broke down in the first place. If there's no infection and just itchy skin, there's a number of things we might do, ranging from topical treatment, shampoos, salves, conditioners. There can be some holistic interventions with omega-3s and fish oils. There can be pharmaceutical intervention from tablets like antihistamines. There can be more formal allergy medications given by mouth. There's even some injectables that last, that are antibodies that can block itchy cycles for about 4 to 8 weeks at a time. There's a number of different products we have to control itch in dogs. And then lastly, if your pet is experiencing more kind of chronic or ongoing itchiness, if they have an infection that's not responding as we would anticipated, we can do what's called a culture, basically grow that bacteria and figure out which antibiotic or antibiotics can work and be successful against that rather than kind of assuming from the front. Additionally, your pet might require some blood work, especially if we've been battling this itchiness for a long time. So that way we can kind of undermine if there's any underlying conditions in terms of low thyroid production like hypothyroidism or high cortisol production called Cushing's disease, that can be conditions that can weaken that skin barrier and be working against us. So blood work might also be a part of your pet's plan.